So we're going to discuss computational aspects of neuroimaging. And I know a lot of you have been in the discussions that James Stone has been organizing on neuroimaging and more broadly. So we've had a little bit of these discussions already, but we can continue them here. So maybe I'll open it up to just here to everyone as to what we think are the biggest needs in the computational side for neuroimaging. Do we think we need more expertise, more resources for imaging, analysis, or maybe programs, seed grant programs that bring people that do the analysis to the people who are doing the imaging? What do we think are the biggest needs at UVA? Does anybody want to jump in?
Tom, I know that we're sort of having these conversations in the context of the grand challenge, and so I think we can talk about what our individual needs are, or what we feel the needs of the community are. Would it be helpful to sort of also paint the picture around what we feel the grand challenge is when it comes to computational neuroimaging?
Sure.
And I don't know that I've got an absolute answer to that at this point, but what's sort of the vision here for computational neuroimaging that we may be able to achieve if we had the right resources?
Right. Yeah, I don't know that I have the right answer to that either. What the vision is either, and I think that's part of this session. Maybe is to just try to form that vision. Part of the discussions we're having. But I can say what personally, I can start to envision is we have a pretty strong core already of people in engineering and in data science who do computational and artificial intelligence, machine learning applied to imaging broadly, and then a lot of us are very strongly focused in neuroimaging. So I can count 3 or 4 faculty here in engineering, and at least a couple over in School of Data Science, including Jack Van Horn on the other session there, and Idong here in engineering is one of the engineering faculty. And we have Brian Avance and Nick Tustison, who are through part of radiology that are very strong researchers in computational neuroimaging. So we have a core of really strong people and expertise, and I think we don't have a very organized way of kind of forming collaborations with the people that do neuroimaging, and how we can strengthen that and become really like a powerhouse in neuroimaging data analysis. I think we have a lot of the pieces in place, and how we connect the right researchers in the School of Medicine and maybe psychology to the data analysts in the most effective way, and give us the kind of support and to make those connections and strong collaborations. That would be what I'd like to see out of the grand challenge for the computational side.
Yeah, and if I can maybe sort of add a layer to that, I think an ideal vision here that I think it's achievable at UVA because it's a fairly collaborative environment, and it would be unique if we were able to pull it off, is a general idea that we've got data neuroimaging, data analytics that's functioning as a part of a broader ecosystem where the resources that we have here around data analytics, both expertise and also computational capabilities, is able to interact with on the clinical side, as a part of a learning healthcare system. So we don't have barriers to being able to access this massive amount of data that's being generated from clinical care on a day-to-day basis. So we're able to navigate the barriers there, and neuroimaging data analytics is able to plug in sort of a barrierless or minimal barrier way. As another element of that ecosystem is that advanced data analytics around neuroimaging are available to all. And so, the model for that is not teaching each individual research laboratory how to do good, neuroimaging computer science. It's having neuroimaging computer science as a service. So I may not know how to do flow cytometry, but I know how to pick up the phone and call the flow cytometry core to be able to run my samples. And we need to have a similar capability here at UVA, where we have neuroimaging data analytics as a service. So people can not only acquire their imaging, but they also have the capability to be able to analyze their imaging in a robust and sophisticated way. And so again, I could see the grand challenge around analytics being, breaking down barriers to allowing our infrastructure and personnel expertise to truly support many of the missions across UVA, from clinical to breaking down those barriers around accessing data, to research, to breaking down barriers to allow people to be able to actually access these services, and then building up the excellence of the services as a whole, in recruiting high quality faculty with the appropriate staff and data curation resources to have a really thriving core that helps to support all those missions.
Okay, great. Yeah, I think that's something I hadn't thought of, but it's a really great point. And I wrote down a note to make kind of advanced data analytics available to all. This notion of a service that everyone has access to. So I think that's a great idea, because with that we don't really have. We have a lot of expertise, people that develop new methods, but we don't have the manpower and the capacity to make it available at a large scale to everyone who may want it. So that's, I think, a really great point.
And I think the important point here is that it touches every single mission.
Right.
There's no focus area that's been discussed so far that wouldn't be benefited by having this as basically a core offering.
And yet the barriers, the other point you made, the barriers to access to the data, how do we transfer and store and organize data from the hospital to this core data analytics, whether it's in engineering or data science, or maybe probably both, I think is a really key point as well. We need infrastructure and kind of the systems in place to do that. We don't have that either. Yeah. So these are excellent points.
And I think, again, not to sort of script this, but, I think the idea of having this ecosystem, where data analytics is able to participate in an unfettered way with all of the missions around the institution.
Yes, that's great. Okay, anybody else want to jump in to add to that, or have other points to add?
Yeah, sure. Thanks, James. That was a really good way to describe it, a need or an opportunity here. One of the things I'm wondering about, and obviously in the imaging side, we've discussed this, right? In the imaging meetings, we've discussed this, but one element that we need here is people with expertise in the image acquisition side and focused a lot on neuro, right? I mean, I do some neuro, but what we need is, well, I don't know, a Fred Epstein of neuro, right?
Right.
In other words, or more than one probably. And I'm not sure what modality or what combination of modalities that should be, but as part of this grand vision, we should have that. We should have people that can interface directly to the hypothesis generating people in neurology or neuroscience or wherever, and understanding what their needs are, suggesting novel ways to acquire the data, and then then the two of those can then directly interface with the data science, the data analytics people. And so that can be a powerful sort of set of people. And so whether this is PET or MR or photoacoustic microscopy or what have you, I think that having people that have technical expertise and can push the boundaries of what you can image, connecting with the data people as well as with the hypothesis generating people. We need people like that here. I mean, you see that in lots of other places. And so exactly where that fits into the grand challenges pitches, I'm not exactly sure, but I think it's an opportunity here for us to really push things forward.
Yeah, Craig, I think that's a really important point because, you know, we tend to think of data analytics as a post-acquisition activity, but you're absolutely right that data analytics more and more are playing a significant role in how we acquire and how we actually reconstruct the data. So that's really important. I know we've historically had that expertise here, but unfortunately we weren't able to retain that expertise.
Yes, I agree wholeheartedly that we need someone like this. Yeah. Okay, great. Let's see, anyone else want to jump in, add something to add?
Yeah, this is Gustavo. Thanks for the opportunity. I'm wondering, just want to hear your guys' thoughts on, beyond, let's say, data science as a service for the imaging community or some other one, whether or not there is enough of a collective vision to put together as far as what the group at UVA, broadly speaking, can contribute towards the data science itself, and how that may be different from efforts that have been going for 20 or 30 years in the medical imaging community, how we could differentiate from what's going on now at other institutions. Is there anything different and necessary that is different, new, that we as a group could collaborate and contribute on beyond just data science as a service, as a core facility?
No, I think I think many of the investigators that Tom referred to earlier are actively, and Tom as well, are actively publishing and making significant contributions to neuroimaging data analytics, whether from a tools perspective or an applications perspective. And so I know we haven't talked too much about sort of, some of the novel development activities that's occurring in the neuroimaging space individually, but it's significant. I guess the question there is, is there anything that's needed to augment what's already being done by existing faculty at UVA?
Yeah, I mean, my first question is, what is being done? Can we agree on a grand challenge that, UVA as a whole could collaborate and contribute together to differentiate ourselves, so that, of course, there are many investigators there around. Some are not anymore, but some are. And each investigator will have his or her paper. The question is there a collective vision that goes beyond the individual papers from each investigator that we could put together into a broader, a bigger goal, a goal that we are set up uniquely to collaborate? And if so, what is it beyond individual papers, which we all have?
Well, I think, go ahead.
I was just going to ask Gustavo what his thoughts were, but go ahead, James.
Yeah.
I was just going to say, I think we've got a couple of nice examples of investigator activities here that have sort of transcended just publishing papers. So, Nick Tustison and Brian Evans and the work that they've done in building advanced normalization tools, and all of the different elements of that's open source and it's used globally. Bijoy Kundu and his work that he's been doing with parametric PET and he's developing that and supporting a number of other investigators. And so I don't know if that kind of gets to the question that you're raising, Gustavo, but I certainly think that we do have faculty that are contributing on a national and global level with open source software that transcends simply publishing a paper. So I don't know if that gets to how we sort of bring people together more collectively at UVA, but I think we've got great examples of significant strengths in this area. I guess the question is, is there anything that can be done to sort of further augment that?
Right. And I think maybe
the question is, is there anything that can be done to not only augment each individual effort, but is there a grand challenge that these efforts could coalesce around to and contribute something that is substantially different from another institution, right? That is, there are many investigators. You can highlight this paper from this person, this paper from that person, the software from this person, the contributions from this person, and so on. The question is, as this effort, I think, is geared towards putting people together to contribute to something bigger than a single investigator effort, right? And the question is, what is that effort, and how do we put it together? Can we agree on some?
Right. I think this is a great point, Gustavo, and I don't have an answer, but because, like you said, we all sort of work in our own, us data analytic people are work in our own silos, write our own papers. What do we have? Where do we have commonalities? Where do we have opportunities for standing out when we work together? I can maybe mention one possible idea, which is in brain connectivity from neuroimaging. So I think we have, myself doing a lot of diffusion MRI, kind of the white matter connectivity, Jack Van Horn doing a lot of brain mapping in the networking session right now, and then others, and maybe brain mapping, brain connectivity from neuroimaging would be one place we could join forces. Several of us, and also Brian Avance and Nick Tussison have done work in that area. I think you've done some work in diffusion MRI a while back. So anyway, maybe this is one possible area. There's probably others that we could think about. We have a lot of people that do image registration, for instance. So and that can be part of mapping the brain, normalization, as James mentioned. So maybe something along those lines is.
I think that's a reasonable first thought. The next question would be to ask, if we put something together like that, how would we differ from what's going on at Johns Hopkins? Right. As you know, there's a lot of people doing that, or UCLA, or UCSF now,
exactly.
Or Montreal, McGill. How if we put these folks together towards a similar mission of what these other folks have been going at cohesively for 10, 20 more years, right. How do we compete? What do we contribute something new in that area?
I think
that's a discussion I wanted to get started.
Yeah, think about what are our strengths kind of clinically in kind of the med school research area, areas that we could maybe focus on that would distinguish us. So maybe there's so it's a great question. Yeah.
I don't think we need to be unique. I think we need to be preeminent, and that's
right.
not.
Yeah, you're right.
Same thing.
But we need to differentiate ourselves somehow. But you're right. Not unique. We it's hard to be unique.
No, I agree with that. I think we can define ourselves uniquely by our level of excellence in a given area, and so. The fact that Johns Hopkins may be down the road and they're doing work in this space shouldn't be a deterrent for us to do something that may be similar, but is distinguished by our level of excellence.
But yeah, it can be focused clinically or for a fundamental basic science question where you get a lot of people ready, sort of the equivalent of a program project, and you focus them together on a given clinical problem. I've seen this again and again in the cardiac world, where you push the technical and the image analysis and the quantification forward based on particular clinical challenges, particular clinical opportunities. And that leads to novel, again and again, that leads not just in cardiac, but throughout MRI, for instance, advanced new methods that are driven by the problem you're trying to solve or the question you're trying to answer. And so you can't do that. And you need the expertise, you need the equipment, you need the dedication, you need the community in order to do those sorts of things. But we can put those things together. Here, we're not starting from the problem exactly. We're starting from the fundamental opportunity of the combination of imaging and analysis and computation. So I don't know. I don't have the answer right there. I mean, I have specific ideas from other, like the world of focus ultrasound is one way to study connectivity as well as doing the clinical things. And you could, but yeah, you're right, Gustavo, you're right. We need a vision here, a grand challenge to describe what we're going to do. It seems like you're looking for some kind of overarching, completely new technical challenge. Is that right, Gustavo?
I'm not looking for anything. I'm just looking to hear what your thoughts are and your ideas. I don't have a specific grand challenge in mind, or whether it is more focused on clinical applications, where it's more methodological, mathematical, whatever. It's just a question to hear your thoughts.
Yeah, I mean, conversely, we'd love to hear I think we've put some ideas forward in terms of what a grand challenge might look like. I think we're all here to contribute in that manner. So if you've got ideas on what would meet the mark, what would be differentiating, this is definitely the time to put those forward.
Yeah, before I can even think with some structure around the topic, maybe seeing what is there already as far as written, as far as a grand challenge around these topics, right? How people here in this community, how they're speaking to each other, what they're thinking, what they're proposing. From what I've heard so far, the core idea of data science as a core, like as you look at, as you mentioned, the flow cytometry core. Interesting idea. I'm fine with that. The question was there anything beyond that? And I haven't seen, if there's some writing, some clear statements, some ideas that other people have already proposed. I would love to read them or see them.
I think what it's really important to understand is that we are the group who are actually creating those ideas. So nobody else is going to create that, because there's so much activity that's occurring in the space at this point. So if we don't come up with those ideas, nobody else is going to do it. And so it really is up to this group to decide what that grand challenge is. Otherwise, it's just going to be subsumed by all of the other activities that are occurring that feel as if they warrant investment in this space. So I would just say we can't wait for somebody else to do that. We need to do that, define that vision, and make the justification that it's worth investing. Otherwise, nothing's going to happen.
Okay, so it looks like we are done in 15 seconds. So I think that's a good place to leave it there. And we'll come back to the main group. I've made notes for all the things we talked about. We can discuss with the main group here. Thanks, everybody.